At this time, I'd like to introduce Dr. Carrie Starr, Executive Director of the Community Institutes at Roberts Wesleyan College, who will introduce our special guests. Carrie?
Thank you, President Porterfield, and welcome everyone. We're thrilled to have you joining us this morning to discuss the Great Resignation and what that means for each of us. Today's Leadership Breakfast is just one of several key initiatives that the Business Solutions Institute is hosting to meet the needs of organizational leaders like you across Rochester and beyond. Now, if you'd like the learning to continue beyond this morning's event, please join us in one of our online mini courses designed to equip and inspire you and your whole team. In January, we're launching a 3-week course on the Enneagram at Work, a key to inclusion, collaboration, and productivity. And then in February, we're launching a 6-week soft skills training suite called The Heart of Business. Now, these courses, they're both fully online and actually qualify for a special discount if you register 5 or more people from your team by Thanksgiving. And my colleague Michelle has put a link to both of those courses in the chat so you can find out more. So go ahead and open that link in a separate tab that you can explore later, because right now it's time to meet our special guests. We want to extend a warm Roberts Wesleyan welcome to Adrienne Hale, who is the Senior Manager, Talent Strategy, Workforce Development, and Education Initiatives at the Greater Rochester Chamber of Commerce. Welcome, Adrienne. Karen Zandy, President and CEO of the Mary Cariola Center and a 2021 Rochester Business Journal Circle of Excellence winner. Welcome, Karen. So glad to have you with us. And then Marisa Geithner, President and CEO of Heritage Christian Services, also a 2021 Rochester Business Journal Circle of Excellence winner. What an all-star panel we have today. And yet, as we've been chatting before the broadcast began, we're all simply human, and we're going to share kind of what this reality has meant for each of us. So we're so honored to have these distinguished leaders with us. For all of our attendees, you can use the Q&A feature at the bottom of your screen to ask your questions of our panelists. So you can direct a question to a specific panelist or to the panel overall. So let's get started. Karen, let's start with you. How has this Great Resignation impacted your team at the Mary Cariola Center?
Good morning. Thank you for having me, and welcome everybody. First, what I'd like to do is just share a moment. I don't want to make the assumption that people know Mary Cariola Center. So a little quick thumbnail overview. We're an organization over 70 years old. Mary, our founder, was a dynamo, a person who in her 50s said, you know, this is not right that children with disabilities can't live with their families. If you think about over 70 years ago, families with children with disabilities, they were advice of the professionals is children should be institutionalized, you know, if you had significant disabilities. And I apologize, that noise in the background is my dog. So you are in my kitchen, welcome. I'm trying to keep her quiet this morning. But so there was a young man in Mary's family who no one would take in school. So we started as a school, and at this point are over 450 children that come to our school ages 3 to 21, and over 50 districts, 10 counties. A couple of our kids come as far as Syracuse, Niagara Falls. So it is a long day for a couple of kids that come from quite a distance. I think it speaks to the specialization of our school. And we also have 6 residents. So our homes serve over 44 individuals and some respite opportunities. Scope of the organization is nearly 700 staff. I'd like all of those positions to be filled. It's not happening right now. You know, that's our context. But, just to share a little bit about, to your question, the human services field has had turnover for years. It is not unusual for human services to be a starting point where people start to evaluate their careers. So in my experience, 20% turnover isn't necessarily really high. So I want to say to the rest of the community, welcome to our world. with issues of turnover. But in the last decade, we have had to really shift our focus. Our mantra was, it's all about the kids, it's all about the kids. We really struggled as a leadership team to say, if we don't make it about the grownups that serve the kids, we're not going to have people here taking care of our kids. We're not going to be successful with our mission. When we shifted that, we really focused on career development, dove deeply into developing what are opportunities for our staff to grow and learn, and thankful to the relationship with Roberts. Actually, we established some scholarships at Roberts, and with the corporate partnerships, we've really done a great job with engaging some of our staff to become fully certified master's prepared teachers. The social work program is very strong. But I think about it in the context of while each child that we serve is an individual, so are the people who come to work at Carriola.
Yes.
It is important for us, as Dr. Porterfield said, we're attentive to the physical and emotional well-being of our grownups that are on our campuses and in our houses. What we've learned during COVID is families changed their focus. So two-income families decided maybe we can do okay with one income. Loss and grief and stress that impacted people helped and challenged people to shift their priorities, what's important in life. Probably many of the people participating this morning had a personal loss. And so if you think about that, what we know is it's not just the paycheck. It's not just the paycheck that keeps people.
Yeah.
While, we've all moved to the $15, we did move several of our positions up. Frankly, we were over 15 for quite some time, but we really had to lift up some of our positions, but really have spent more time evaluating the agency's culture. How does that impact the adults in our workforce? Focusing on what people need to feel healthy and give of themselves to those who we serve. And actually, one of the things, bringing a counselor on site every week, I'm telling you, his schedule is full. We've invested a lot in the current year, but we also need to think about the future. So we're grateful to have some one-time money that the governor just announced yesterday that is pushing into some of our services, but it's not enough for sustainability over time. So as people are evaluating their lives and what are they going to do next, it's just important for us to keep the focus on current needs, but also future.
Oh, thank you, Karen. Wow, what a great start, everyone. I really appreciate that perspective and some of the really tangible things that you've done. And thank you for welcoming us to your world of this new reality and reminding us that this isn't new for everyone. And so I'm glad we can learn from you, Karen, and others like you. So Marisa, Heritage Christian Services operates in a related field. In May, your team made a bold move to raise wages, impacting over 1,300 employees. Can you tell us more about that decision and what's happening at Heritage Christian Services?
I'd love to. And similar to Karen, for those of you who don't know, since it does seem like we have a broad audience here, Heritage Christian Services is also a human service organization with our roots in serving those with intellectual and developmental disabilities. I don't think Dr. Starr knew until this morning actually how connected Heritage Christian and Mary Carriola are. Our founders, they grew up. And as they age beyond the services eligible at Mary Carriola, our organization was founded to be able to try to carry on that quality. And I myself, over 30 years ago, began my career serving direct support at one of the homes operated by Mary Carriola, and I've never looked back. Heritage Christian now serves about 125,000 people across the greater Rochester, greater Buffalo area. And we do that with a beautiful army of over 3,000 employees. And as I mentioned, our roots are in serving those with intellectual and developmental disabilities, but we currently reach the broad community through our community impact programs like our Health and Wellness Center, the Peters Family Life Center, the operation of Springdale Farm. We have 3 wonderful child cares, Expressive Beginnings Childcare, Eleversity, an educational branch, the Employment Alliance, an employment branch. on equestrian therapy stables, and I could go on, but that work is so important. Those community impact programs are so important to us because they welcome in the richness of community. So to speak to the issue of wage, because I'll start by saying I couldn't agree with Karen more, and I know Adrian is agreeing, this is not simply about the paycheck, but for our industry, it is about self-sufficiency, to continue to ask people to give so deeply of themselves in positions that they can't gain self-sufficiency is just not okay. So I hope you're all familiar and connected to the powerful anti-poverty movement that's happening in our community, led by our MAPI. It is unique in our community, and our MAPI has done some comprehensive research and shed light on some of the things Karen and I are talking about. The fact that caring professionals in our community were living below a level of self-sufficiency. And sharing those results with the broader community led to some tremendous change. For us at Heritage Christian Services, that was a 5-year plan. We basically started moving when the fast food minimum wage moved, and we knew we were going to be in trouble if we couldn't find a way to keep pace. We did think that the disruption and the subsequent expense of COVID would likely delay our plan, but thankfully we were able to leverage some federal resources and get that minimum wage up to $15 an hour. To Karen's point, many of our organizations were paying some of our positions above that, but we really wanted to get those caring professionals up above that $15 an hour. So we moved early on when the University of Rochester and Rochester Regional moved. And to date, I think we were the second largest employer by number of employees, impacting 1,326 amazing employees. Others followed, including Mary Carriola. Thank you very much. And I believe to date, 32 additional employers have raised their wage to at least $15 an hour. And that work has impacted over 10,000 workers in the greater Rochester area. So if I've piqued your curiosity and you'd like to know more, I would direct you to visit the Level Up webpage of the United Way of the Finger Lakes. It is important to note that, and again, Karen mentioned that many employers, and I know many who are listening and joining us today, including Heritage Christian, did this without any increase to our rates. And many while weathering cuts in the midst of this unexpected cost of navigating the pandemic. So how on earth and why did we do it now? And why did so many make this commitment now? Well, quite frankly, let's be honest, amongst business, this was an issue of sustainability. To come to our office, which people don't need to come to our office to interview anymore in this day, but when they did, they were passing a Dunkin' Donuts, a Taco Bell, and a gas station, and we're all advertising a starting wage higher than our own. So quite frankly, we simply couldn't sustain any longer without moving that minimum starting wage up a little bit more. In addition, I think we were all ready to take a stand and demonstrate that we needed to show results in taking a step towards self-sufficiency. For those of you who aren't familiar, in New York State, caring industries are upheld by employees who are 90% women, 77% people of color, and 60% immigrants. On top of that, in our country, unfortunately, nearly a quarter of children are raised in single adult households, with of course a majority of those single adults being women. These caring careers, like direct support professionals, home health aides, certified nursing assistants, have long proven themselves valuable and essential. No time more directly than 2020. And we all feel it is definitely time that we understand that the person providing the service is also valuable and essential. So we had to step forward and exercise financial risk in order to show our funders and our legislators that a more sustainable wage could in fact preserve the care industry, right? In order to combat hopelessness, we need innovation. This can spare our caring industries. And it is important to know, I have to reinforce, this will be the third time you've heard it between Karen and I, $15 an hour was a minimum step, not the destination. And we need help to continue to move that level of pay and offer true self-sufficiency for care professionals.
Wow, thank you. Thank you, Marisa. That is powerful. And thank you to what you and Karen have both done to not just impact your employees and your culture, but the broader community. I love that this is part of a much bigger effort. And that's part of why we invited you both to be here, because you're such shining examples in the community of caring for your employees. And if you can do it, we can all learn from you. So I'd like to turn our attention now to Adrian. In your role with the chamber, have you seen Rochester businesses reduce job requirements or use other tactics like raising wages to make the hiring process either faster or simpler as the competition to find workers heats up?
Yep. So first off, thank you so much for that introduction, Carrie and Marissa. You got me all pumped up, so I appreciate that. So the Greater Rochester Chamber of Commerce, as a business services organization, it is our mission and our job to respond to moments like this so that employers have an understanding of what's going on across different industries and sectors and what kinds of best practices they can implement in order to give themselves that competitive advantage. Prior to even the pandemic, the economic development and private sector already launched an effort called Rock 2025, which was how are we going to make Rochester, Greater Rochester, more competitive with its peers across the state and the country. So the main tenets of that was how do we promote our region? How do we get businesses to relocate here, the ones here to expand and to grow? But most importantly, how do we build a talent strategy that meets the needs of our community, right? So I oversee that talent strategy and workforce development. The talent strategy is to ensure that we produce and provide the necessary and required talent that employers are looking for. And obviously that's where the pandemic kind of interrupted a lot of what we had going on. But we ran a survey earlier this year to hear from employers about what some of their needs were. Many of them reached out and said they'd like to be tapped into that high school workforce, people who are just getting ready to graduate from high school and are in that first year out of post-secondary. Others said they wanted to tap into some of the talent on our college campuses. So we've launched efforts like Campus Rock so that they can start to interact with internships and co-ops with some of those students who are here so that they don't want to leave here once they graduate. And there's a huge interest now, and this is to Marissa's point, and we sit around a number of different tables together and partnered on many different events, but how do we upskill the no-skill, low-skill segments of our community who've been excluded from actively participating and engaging in work? And what that's taken is on a number of different strategies. I'll talk about some of them just really briefly here. One is Rock Seeds, which is a partnership between the Chamber of Commerce, Monroe County, and our Workforce Development Board, Rochester Works, to say, how do we get disconnected young folks from 18 to 24 years old into some of these different jobs so that they can access work with a $15 an hour wage and also all of the different supports that they need in order to work. So the workforce development piece is hitting right here. Transportation, childcare, different social emotional supports. How do we ensure that they're successful and that we improve employment outcomes? We subsidize the wages of these workers for 10 weeks. And then the only expectation we have post those 10 weeks is that these employers take them on full time. In addition to that, we're modeling that for adults in a program called Resource 101, where we just co-hosted an event with our MAPI on Tuesday. And we have these private, information sessions where DHS with Rochester Works goes around and tells employers, these are all of the different benefits that exist for your human resource departments and your first line supervisors and managers to support their employees so that you don't feel the full burden on your organization. And those have been two of the most crucial strategies we've employed since the pandemic. I'll close with this piece. Aside from talent strategy, workforce development, the way we define it here at the Chamber, is actions and efforts that are to enhance the quality of the performance and productivity of the workforce that exists. So that is childcare, that is transportation, that is some of those social emotional needs. But in addition to that, it's also become diversity, equity, inclusion, and belonging work, because we've recognized that for the hundreds of thousands and millions of dollars that our community has invested in upskilling, reskilling, training, and educating, we have to ensure that the conditions in the workplace itself are favorable to the success of all Rochesterians, regardless of their identity and whatnot. And how do we work with organizations hand in hand to build and foster a climate that is conducive? So we've had a number of different employers show up to our Colors of Success series, which is a best sharing platform that we host throughout the world of work, but also we have a customizable training option where organizations can reach out to me and say, hey, Adrian, we want to do some of the deep DE&I work. We want a cultural audit. We want to find out what we can do to produce a high performing work team in our workplace. And that's been the way that we've been responding to the pandemic to support employers.
Wonderful. Thank you so much for giving us those specifics. And I'm sure there are people who are joining us today that weren't aware of those programs, Adrian. So thank you for highlighting those. I'd love to go back to you, Karen. Do you have any other strategies that you would suggest to businesses and community leaders as they try to attract quality employees to fill their open positions? What can they do? What can they learn from what you've learned? Oh, go ahead and unmute yourself, and then we'll hear you and the dog, and that's okay because that's the world we're in right now.
She settled down a little.
Oh, there you go.
Yeah. So I'm also looking at a couple questions in the chat. And Adrian, can I say your determination is inspirational. There's a couple things that you really hit on that I would say are really important. And as several of my board members have said to me when we talk about it at our board meetings, Karen, there's no magic bullet. And it is probably some reinforcement of basic good employee practices that people just have to be mindful of. And frankly, we just have to prioritize them. A couple things about paying attention to culture, diversity, equity, inclusion. Many of our organizations are taking a deeper dive and really self-assessment. And what I would say is assessment is part of an intervention, right? But coming back to a couple things that we really prioritize at Carriola is, and I call this the parallel process. If you want the caregivers or any of your staff to be attentive, you have to focus on them much like you do on your direct customer. And I say the children that we serve. We have to understand their individual needs. You have to understand your employees as individuals. Know your people. What is it that matters to them? Whether it is an individual plan about where I'd like to build my career. There's a question in the chat about, what do we do other than direct care? The same things that you do for direct care are really applicable to some of your management and leadership. You have to understand what's important to them, what matters, what they want for their future, what they want for their workplace life. We talk about our team building. And if I think about some of the broader interventions that we've done, our culture, I believe, is really built on servant leadership. I'll say to people, what do you need from me? I have an open hour in my schedule today. How can I be helpful? And truly it has been doubling his reception while I'm on a Zoom. And I love it. If I can truly come in and support people where we're shorthanded, it's impactful and it's very fulfilling to me personally. I get to connect with people who I know a little bit more about them. The size of our organization allows me to do that, right? Who had to travel out of town to care for a dying relative, who had a baby. I know that groceries appeared on the doorstep of one of our staff whose family was completely in quarantine and she couldn't figure out what to do. So it's individual support and intervention. Our other broader initiative that we implemented a few years ago was really focusing on what do our supervisors need to make them strong supervisors. We adopted a model called Interactional Supervision. Training in that, and it's really a balance of support and accountability. What do you need to be successful in your job? But what we've also learned through that is our supervisory folks have had to learn a little bit more about the folks they supervise. Just a silly example. Instead of somebody's late for work, instead of saying you need to be on time, you need to be on time, we need to ask a little bit more about, so what's going on in your life that you're late?
Yes.
We've learned about domestic violence, that some of the people who work for us don't want to leave home until their partner's out of the house. We know, and Adrian, to your point, we know Rochester is fraught with disparities. People are living in challenging circumstances. In our new employee training, I talk about our culture. I highlight the individuality. Everybody came from a circumstance this morning. Who was woken up in the night because there was a shooting in the neighborhood or the police were involved. We know that what our families experience, our staff also experience that. When there's an event in the news, I kind of just sort of step back and go, okay, if I wait a day, I'll know how one of our families, either somebody we serve or an employee, is touched by that. So we've had to really, and maybe the parallel is for different industries, you know what your end result is of your work, right? Where you want it to be. You need to come back and figure out how to engage those employees as individuals and what's important for them to help to fulfill the mission. They have to be whole, feel connected to the organization, feel mission driven. Whether you're, trying to develop the HVAC professionals or whether it's direct service. And also to Adrian, your other point about attracting to Rochester, I think Rochester is really special. We know that some of the families that we serve actually have moved here because they need the supports of the great medical community that we have here. Golisano Children's Hospital is very specialized for some of our kids with multiple and complex disabilities, and they want their kids to come to Carriola. They talk to us before they move to Rochester. What school district should I live in? How can I get my kid involved in your services? I know I want my kid to go to Carriola. Help me do that. And their providers are here. Rochester is really rich in resources. We're committed to being a good place to work and raise your family. And, everybody knows that family and work balance that we need to achieve. I'm hopeful that during COVID, that families got a greater appreciation for what it takes to be an educator. So as they head to Zoom lessons with their kids at home, I hope that our society develops a deeper recognition and appreciation for what it takes to be an educator, and that the waves shift, like Marisa was saying. You look around, who are the teachers? I'm sorry, it's women of childbearing age, and I would like to have a few more male teachers, but it's really important that our society recognizes the value that service providers bring to the community.
Thank you, Karen. That's so helpful. Marisa, will you add to that kind of what else can be done to keep the best employees on our team, both at Heritage Christian Services and other industries, other folks that are here? What tips could you give them? How can they keep these best people? We're all afraid of losing them now.
Yeah. Well, it's very interesting. I do have to say, I'm just so grateful. Again, the richness in our community. I hope your pencils were on fire when Adrian was speaking of all of the things they're doing for our community in workforce development, because friends, here's the real news.
Yes.
No matter how you think you're serving, no matter what you think is your core competency, going forward, your core competency needs to be workforce development. And we have rich resources in this community. You don't have to reinvent the wheel. This group right here is better than coffee for me. So I'd love to start every Monday morning with this just quick conversation. And you would have thought we coordinated, and of course we didn't. But I want to reinforce what can be done to keep the best employees. It is a minute by minute, hour by hour, day by day effort. It's nothing you pick up and put down. You need to ask, you need to hear, you need to learn, and you need to change. And we all know the change isn't as easy as we'd like it to be. Our workforce is changing in seismic ways, and we can't predict or understand the hopes of our workforce if we don't share lived experience. You have to engage and consistently ask. You have to demonstrate that you're hearing, which is different than listening.
Yes.
Learn from
Yes.
them, map out the change. And here to me is the hardest part, consistently accounting back to the workforce all along the way, how you've made change that they've led. And communication strategies in this day and age are not easy. I know we're working at that. Our 3,000 employees, we have over half of those employees who never serve within the walls of Heritage Christian Services. They're serving in community and in individual homes. So to the earlier points, we need to deeply study the diversity of our workforce, and we need to seek very meaningful ways to include them and hope that we can become an organization that can create a space where people truly belong. Once you get there, people stay. People stay no matter the work that they're doing. With that, I have to also share, I am a huge fan of a success coach. So if you're not familiar, the Employer Resource Network, which has networks all across the country, including Rochester and Buffalo, is a diverse network of employers that join together to fund a position of a success coach. A success coach, in my experience, isn't like anything we already have. It is a person who is available to be the first call when an employee, particularly an under-resourced employee, has a barrier that's interfering with successful employment. I don't think Karen would mind me sharing. There have been many times that Karen and I have been on the phone together because we've been the first call, not the immediate supervisor. We've been the first call when someone is living in their car with their children. And with the best intentions and hopes, and we do our best, we are not the experts to be able to help them navigate that immediate barrier that is significant. So for our organization, use of a success coach has been so helpful in that. And now let's talk a little bit about what under-resourced means, because for many of us, we might have immediately gone to under-resourced financially. It is much deeper than that. We have employees who don't have strong relational resources. Maybe they have relocated here and their family is out of the area. Maybe they've not yet developed deep friendships to be able to step in when life happens. Maybe people aren't particularly emotionally resourced given time in life. And maybe it's as simple as they live in an area where resources aren't as readily available. When you put all those things together, the group of employees that can be supported by a support coach is very, very broad. Success coaches help employees overcome timely barriers, and then, if and when appropriate, provide a warm introduction to a more long-term service or benefit. So I also love it because a success coach has helped our employees use some of the rich benefits we've invested in for years that have gone underutilized, like EAP. Success coach isn't a substitute for EAP, it's a complement to EAP. And now we see our employees using it even more. So currently in Rochester, because I know we have many of them on the call, across Rochester and Buffalo, we have progressive companies including Catholic Charities, Catholic Family Health, EPI, Jewish Senior Life, MVP Healthcare, the City of Rochester, St. Anne's Community, Trillium Health, recently joining Thompson Health in Canandaigua, People Incorporated, and Heritage Christian. It is a huge and growing, powerful network of employers committed to workforce development. And again, the good news is we didn't have to design this model. We don't have to come up with all of our own strategies. We are using the strategies of community and we're sharing those resources together. So if you're interested in learning more about that, I'll place the contact information in the chat for you, but I'd really encourage you to look into a model of a success coach for your place of employment.
Oh, that's perfect, Marisa. We actually have a question. Someone specifically asked, how do we, pursue a success coach? So thank you for being willing to put that link in there, because that sounds fabulous. Really appreciate that. We do have some great questions coming in, and please feel free to keep putting your questions in. Adrienne, we've got one specifically for you. I'm going to just read this out, and then hopefully you can give us some links as well. How can we find out about the programs for high school graduates that you mentioned? And then after the pandemic, there are many young people who are having trouble making the transition to the working world, especially since college is no longer the expectation right after high school for many. A lot of people have taken kind of a gap year or put their education on pause. So can you help us with that?
Yes, I can. So first and foremost, the RockSees program has a website. So I can put the link to the website in the chat, but I'll also put my email in, because if you're interested, myself and my community partners from the Department of Human Services and Rochester Works would love to do an information session for you and bring you on as a partner. The good news about that program is next year we're going to receive so much more money from the state. That program is going to expand significantly. So please, if you're interested, let me know. I'll put my email and the link to the website in the chat. But also, I'm glad to hear that folks are recognizing that college isn't the expectation, and it certainly is for some. But since then, we've been working with the city school district and our charter school partners on an effort that we call the 4 E's, which is to let every high school student know by the 10th, 11th, 12th grade, you should be on track to either enlistment, which is into the military, like myself after I graduated, enrollment, which is to stay in the college, go on the path to college, entrepreneurship, which is to tap into some of these community resources to start your own organization or become an employee, which is to go into work and be on track to a gainfully employing career. And I'll say this, listening to these two CEOs talk so passionately about these issues means so much to me, because I think it is indicative about how much our community has grown into the complexity and the true nature around work and the challenges that so many different segments of the labor force have to really confront in order to stay gainfully employed and try to make ends meet and ultimately improve the quality of their lives. And I'll say this to Marissa's point about the success coach. In our diversity, equity, and inclusion training, we help supervisors and managers understand that it's not just about learning about leadership anymore, but it's understanding and reconceptualizing what is the leadership in the 21st century workplace. And it doesn't look as much about, managers being agitators and always assuming that employees don't want to work or that they're lazy, because there are some default assumptions like that, but also is understanding what is the context that this person is coming to work from and helping them be more like a coach to get the most from that employee rather than turning that person away. We have to create workplaces where people go from a mindset and an attitude that, this is my job, I'm just coming here because I have to I don't want to lose this job. And one of the things I've been trying to help human resource professionals who take our training understand is that when you tell us, send me good people, right? We try to help them understand there's a whole lot of good people as it relates to their willingness to work and their mindset towards work. But oftentimes it's the conditions and quality of the workplace that might deter that mentality. And so we've developed a tool internally called How to Get the Discretionary Effort, right? That extra oomph from the people who develop your work team or who create your work team. And it's a combination of employee engagement, meaning what kind of training, what kind of collateral duties, how do you help this employee feel a sense of ownership over the duties and responsibilities and the functions of their role? In addition to that, how do you create a high performing attitude, right? So it's from what they won't do, which is when employees are in their job and there are things that they should do, but at times a poor attitude can just make them not fulfill those duties and responsibilities altogether. It's will do, which is just going through the motions and doing the jobs with a bare minimum sense of force. And then it's the want to do, right? Which is I'm coming to work and I'm going to perform with my highest sense of productivity. And that's really where you want a high performing team. So we try to show employers different best practices and interventions to create and produce a high performing team. It's not just about the workforce preparation organizations providing you with good people and high quality talent, but it's about you fostering and developing that talent once they enter into your workplace and understanding that there are things you can do or not do that will affect the quality of their performance.
Oh, it's perfect, Adrian. Thank you. And the Chamber is providing so many wonderful resources for employers and employees. So thank you for putting your contact info in the chat, Adrian, as well as how people can find out about the SEEDS program. I know this is a big part of why the community institutes were founded at Roberts, because we know not everyone is looking for a degree. So we're specifically providing training through the Business Solutions Institute for people to become entrepreneurs, to gain new skills without that degree. But that's also why we have our corporate partners program to make a degree more accessible. And we're so grateful that those of you who are here with us today are our partners and can provide your employees with those discounts. So if they want to get a degree, you make it more accessible. Now, there's a specific question to you, Marissa, and our time is going so quickly. So I'm glad that we can keep learning from one another beyond the time today. But you mentioned $15 an hour, how that wage is a starting point rather than a destination. So do you have any recommendations for organizations in which some members of management are hesitant or resistant to paying a true living wage? What can people do to help kind of move their management thinking along to value that?
I would say study. The statistics are out there, and it is different for every industry. It's different for every industry, but if you're working in an industry where you really believe that your employees are not paid a wage that is suitable given the work that they do, the research is out there. And similar to what we've done in the caring industries, really try to understand who's doing that work and understand the statistics around those individuals within our country and in our community. And I think that brings people back out of thinking so narrowly about a position or your bottom line, and allows people to exercise risk because, right, it gets in your gut. It gets in your gut. You know what the right thing to do is, and then you're all working around that. And, again, it's not easy. Achieving $15 an hour for us across our broad workforce was not easy. Day 3, day 1, we celebrated with our employees. Day 2, we celebrated with the community. Day 3, we were back at the table making plans for our 2022 move. And it requires risk. So you need your leadership team to all have that in their gut, that this is the right thing to do based on who your employees are and what they need in order to belong truly to the work that they do.
Awesome. Wonderful. Thank you. Thank you. Karen, any last thoughts from you before we transition into our breakout rooms, where our panelists are still going to be with us and everyone's going to get a chance to be in 2 different breakout rooms. So we're going to hear from one another what we're doing at this time. But Karen, please wrap us up.
Sure. Just to add to that last question, and I will say that when we raised, it was, several positions that were not at 15 that were brought up. Our middle management staff and some of our clinical staff said thank you. That while it created compression, between some of the advanced degrees, people said thank you. I need those people in my classroom. I need those people coming to work. Some of the other things that I would say, look at some of the business practices that we have, that others have. One of the things that we did was a longevity payment based on longevity, years of service, because I said those senior people that have been around the longest, even though they're not in the higher levels of organizational structure, they were so valuable to us. They're the glue. They're the consistency of quality. So a longevity payment helped with equity because it was some of our entry-level positions that folks that have been there a really long time. Also, contribution to retirement planning. Instead of making it on a percentage, flat amount. So you think about ways that we can, it helps us achieve greater equity across some of our positions. So it's in looking at some of our DEI initiatives, looking at our written practices and how might we challenge ourselves. So it's there's no magic bullet. There are a bunch of things and do them all as best you can. But I would say focus on what you discover are the priorities.
That's great. Great. Such practical advice from all 3 of you. I'm just delighted that you've been here. I feel like we could spend all morning together discussing this. And I am glad that we do have another 30 minutes. So at this time, I'm going to introduce my colleague, our Director of Alumni Relations, Michelle Blakeman, who is going to kind of discuss with us what the next section of our time together is going to look like.
Thanks so much, Carrie. Thank you so much to our panelists. What a engaging conversation this morning. I know I was encouraged by hearing your stories and just the amount of resources that are available to us during this time. Like Carrie mentioned, we're going to have a chance to talk and talk in more detail with each other. I'm going to put the link here in the chat for the breakout rooms. So this way we are able to see each other and discuss in small groups. Click on that link and we're going to get started at about 9:05. So grab yourself a drink, take a bathroom break. We're going to get started at 9:05. We'll do a quick welcome and pose a question for our discussion, and then we'll get started over there. So thank you so much for joining us. Again, please click the link in the chat to get over to the breakout rooms as it is in a different location. So thank you so much again for being with us. We'll see you in a few moments.
Thanks, everyone. Please stick around and enjoy after you take that break.
Michelle, just a logistics, do you want us to click that link too? Okay,
We'll all click that link.
all right. I didn't know if it made us all switch.
So much, Karen. Yeah, so Karen,
Thank you,
Adrian, and
everyone.
Marissa, if you have time, please go ahead and click the link and join us, and Michelle will assign us randomly to groups. We'll spend 10 minutes in each of 2 different groups, and we'll get to share with new folks.
I think we'll give it a moment for everybody to get over there, and then we'll
Gotta get there. I gotta get there.
close it down. Yes, we want to make sure everyone has a chance to click the link.
All right, here I go.
Wonderful.
Okay,
All right,
we'll
see
in
you
a
on the other
moment.
side. All right, Michelle, I'll go ahead